Let me start by saying cancer sucks, and it's probably going to continue to suck until we find a solution for it. That's the reality. It's scary, stressing, depressing, and debilitating. And that's before any treatments, which often tends to exacerbate all of those things, especially in the short term. So, if there were an intervention to help it suck less, from start to finish, with little to no side effects, it would be an instant bestseller. Well, there may just be something that fits this mold. Only thing is, it can't be sold. It's gotta be earned. Here's the very interesting impact that exercise has on cancer. Let's go. Yo, what is up? Welcome back to another week of How to Health. My name is Kevin. I run liftandbalance.com, where we take aim at all things health and longevity and do it in an odd, weird, interesting, and highly sarcastic way. Now, to set the stage, this video is in no way, shape, or form advocating the replacement for any oncologist-led treatment with an exercise protocol. Just making that clear up front. Instead, the goal here is to simply shed light on how exercise may be one of the best bang for its bucks interventions when it comes to maximizing cancer prevention, treatment, recovery, and remission, which kind of puts it in a class of its own when we look for other options that can cover the same ground. So we're going to touch on each part of Badonkadonki's resume when it comes to cancer, and why, if you haven't started already, today is the second best time to get going. If for anything, to hedge your bets the best you can against the odds, likelihood, and probability of disease. You know, like cancer. But not only for that, for the much more encouraging and motivating immediate impacts it has as well. You know, the mental, physical, metabolic, looking cooler naked effects. The ones we talk all about on our previous exercise deep dives. Link below if you want to explore. And here's the thing. All of these benefits, the short term and the long term, are connected. Connected to cellular and metabolic function, because that is at the root of everything. And this fact cannot be any truer than in the case of cancer. So let's take our first stop on this exercise v cancer battle royale and discuss the most ideal scenario for everyone. Prevention. And here's the reality. There is currently no scientific magic when it comes to cancer prevention. In fact, exercise isn't even your best tool here. Way to kick things off, I know. But the truth of the matter is, not doing certain things or not becoming certain things is the most effective way to sway the odds ever in your favor. And I bet you could guess what they are. The usual suspects: smoking, excess alcohol, and becoming obese. Which, to give credit where credit is due, typically lacks living a healthy lifestyle, prioritizing real whole foods, 8 hours of high-quality circadian aligned sleep, daily badonkadonking, stress management, and more nature. If so facto, the best prevention tool that we have. But since it's the focus of today, when we narrow this list and focus on exercise alone, it's proving to be one of the best prevention tools that we have, with research displaying that being physically active can lower the risk of developing at least 8 to 10 types of cancers, and doing so even if it doesn't drive weight loss, which is very interesting. And if you're pondering, how exactly? One of the main reasons for this is likely its uncanny ability to upregulate some of cancer's worst enemies and eliminate some of its key sources of growth, specifically boosting bioactive compounds, which improve metabolic efficiency, enhance cellular repair and recycling, strengthen immune function, and as a byproduct, drive down inflammation. And all I can say is, these stats are pretty compelling, highlighting that being physically active can lead to a 8 to 14% risk reduction for colon cancer in men, 6 to 10% risk reduction of breast cancer, and 10 to 18% reduction in endometrial cancers in women, with emerging data also suggesting protective effects against stomach, esophageal, and kidney cancers, all suggesting that the more exercise a person does, relatively speaking, the better the risk reduction. For example, 300 minutes of moderate intensity exercise per week tends to drive a better risk reduction than the typically recommended 150 minutes a week. And even small 3 to 5 minute intense bouts of exercise, like sprints, stairs, or my personal favorite, burpees, has shown some interesting risk reduction potential as well, indicating that the dose effectiveness could be very much modifiable based on the intensity, which provides some flexibility when crafting a protocol, which is awesome. And also reminds me, don't forget the stretch. And get this, the data suggests that people who are physically fit unsurprisingly handle cancer treatments better, experiencing fewer side effects and faster recovery. But not only that, these individuals have been shown to often experience a less aggressive disease, a later average onset of cancer, and better survival rates, which is really all one could ask for if they draw the short, damn I have cancer straw. Especially when you combine in all of the immediate benefits that exercise induces around mood, cognition, physical function, and sleep. Things that become even more important after a diagnosis. That being said, for the average person in the westernized world, consistent exercise just isn't the norm. Hopefully this video can help them rethink that, but the reality is less than a fifth of the population consistently badonkadonks, and that number is likely generous. So what about when someone's diagnosed with cancer and is awaiting or starting treatment? Is there anything a stressed, scared, and likely confused individual can do? Well, yeah. They may not like it, but start moving that ass. With doctor's approval, of course. As prehabilitation, or starting a more structured exercise protocol prior to the beginning of treatment such as chemotherapy, radiation, or even surgery, has shown some promising effects. Counterintuitive, I know. Because come on, who in their right mind would want to take on two Herculean battles? Cancer treatment and starting an exercise protocol after years of not exercising at the same time? Well, potentially someone who wants to improve their treatment outcomes. Because let's be honest, treatment is often rough and places immense stress on the body. Chemotherapy often leads to fatigue, nausea, muscle wasting, and immune suppression. Radiation causes skin irritation, pain, and systemic fatigue. Immuno and hormone therapy may contribute to inflammation, metabolic changes, and hormone imbalances. And surgery is, well, surgery. I mean, the last thing anyone wants to think about during all that is getting up and exercising. But ironically, that may be one of the best things to do, because there is growing evidence that it could make the respective treatment more effective, and do it in more than one way. First, if dealing with a tumor, exercise can enhance blood flow to it, helping drugs like chemotherapy reach and penetrate the target tumors better. And when it comes to radiation, which works best in oxygen-rich environments, that's exactly what exercise does to our tissue. Oxygenates it, indicating that cancer patients who exercise may increase the effectiveness of their treatment simply by improving how well their tumors receive oxygen and medications. Pretty interesting, I know, but that's not all. Next, exercise has been observed to stimulate an increase in cancer detecting and killing immune cells, improving the body's natural defenses, specifically by increasing natural killer cells, activating T cells along with B cell antibody production. And research in animal models has even shown that exercise can direct immune cells to infiltrate tumors. While human cancer patients who exercise regularly have been observed to have stronger immune function and improved response to immunotherapy. Again, pretty damn interesting. But again, there's more. As a byproduct of all this, it has also been shown that exercise can reduce the number of circulating tumor cells, or those cells which leave the main tumor site to go set up satellite tumors, aka cancer spread or metastasis, with data suggesting that exercise makes it harder for these tumor cells to survive and establish new tumors. Fuck yeah. I mean, Pretty cool, right? And one of the biggest enabling factors of all this is likely exercise's modulation of our metabolic function, as it immediately alters the metabolic microenvironment within the body, regulating insulin signaling, glucose availability, and inflammatory markers that fuel tumor growth, and balancing hormones along the way. All things that tend to be negatively dysregulated by the modern Western lifestyle. And if I were to sum up all of this in one sentence, it'd be: exercise creates an extremely unhospitable environment for cancer to live. And that's the environment we all want. And when we move past treatment and look at the data post-treatment, it continues to impress. As a 2019 meta-analysis reviewing over 2,000 published papers, 8 of which were randomized controlled trials, found that exercise significantly reduces the risk of mortality in patients with cancer and in cancer survivors by 24% compared to non-exercisers, while also reducing the risk of recurrence in cancer survivors by 48% compared to non-exercisers. I mean, those are the odds I would want on my side. Wouldn't you? Another interesting use case for exercise has been in something called active surveillance, or when an individual is done with treatment or just monitoring an early tumor, such as in the case with many prostate cancers. And here's why I say this. A recent study found that men with prostate cancer who perform high-intensity interval training had lower PSA, or prostate-specific antigen levels, which is a key marker of tumor activity. And when it comes to overall survival, as previously mentioned, exercise can reduce the risk of reoccurrence. And this may very well be happening for many of the reasons we already went over, but also its best-in-class ability to preserve and rebuild critical health-promoting tissue like muscle and bone, making an individual more functional and better equipped to live their life. And second, its ability to cultivate an internal cellular and metabolic environment which reduces the risk of other dysfunction and disease to occur, because cancer survivors are at a higher risk for cardiovascular disease, osteoporosis, and metabolic disorders. And the data here is, unfortunately, quite eye-opening, as in the United States, 40% of cancer survivors have hypertension, 15% have diabetes, 5% have kidney disease, 4% have liver disease, and 10% are morbidly obese. So improving overall metabolic health, along with reducing psychological stress, can go a long way. That being said, every single intervention on the planet has some side effects. And there are some cases where exercise can cause more than just discomfort. So it's important to always be aligned with the doctors and hopefully exercise counselors at the treatment facility. But as we reviewed, the data points to much more benefits across the board. Benefits which have one super important common denominator: moving the ass. The opposite of what I'm doing right now. So I would urge whoever is listening to not just do so in hopes of reducing cancer risk, which is no denying a great reason, but better yet, to do so because it will improve your daily mood, feel, cognition, physical function, sleep, cellular function, and metabolic flexibility, while reducing inflammation, pain, and the loss of the oh-so-critical skeletal muscle and bone. And as a natural byproduct of all that, prevent disease, thus increasing one's odds, likelihood, and probability of longevity along the way. And yes, also reducing the risk of and improving the outcomes for cancer. And although a structured exercise protocol, including a mix of weekly strength and aerobic exercise for 150 to 300 minutes a week remains the gold standard, any movement is good movement, even if it's for a few minutes a day or one day a week, as weekend-only exercisers have been shown to still have a significantly lower cancer risk than sedentary individuals. So just do it. That's kind of catchy. May have to trademark that one. And if you are constrained by time or just really hate badonka-donking, short yet high-intensity sessions may be the play. Something like 1 or 2 10 to 25-minute high-intensity sessions per week. But as we talk about in all of our, wow, I didn't know exercise did that powwows. The perfect routine depends on where you are currently at in life. And if someone has been living the standard sedentary life all their life, a simple walking protocol could be the very best place to start. Hell, I've been training for 20 years and I still live by my evening walk. So as you craft the right protocol for you, just remember rule number 1 of exercise. Don't get hurt, because it defeats the whole purpose. So ease into things and train safe. If interested, I'll link a few videos in the show notes below highlighting the different ways to sneakily add more movement into your day. Just think about it, exercising without knowing you're exercising. The perfect crime. Now, it is important to recognize that exercise is not a miracle treatment that can reverse decades of damage. However, it is one of the most promising tools that we all have access to that has dramatic potential to improve whatever situation we may be in. So if you're lucky enough to be a healthy human, the best day to start was yesterday. And if you're battling for your health, work with your doctor to identify ways to help exercise help you, and deal with the unavoidable byproduct of looking cooler naked. But the facts are the facts. Another one being, it's a great day to move.